I'm just kidding. I was uh, I was in the hospital last night and just got out from the hospital just at 7 o'clock this morning. So it was quite busy at the the ER last night up till about 10, 11 p.m. There was super busy, and then it slowed down a little bit. We are for every patient we are admitting, we are checking their COVID status just to be sure as well. And so, Cindy, no Z's. Yeah, no Z's. Not a lot of Z's. Been doing this for a long time, so I walk around like a zombie now. But actually, I'm fine with that. I got this little drink here. I think it's got a little bit of ketones in it, and so it's whoa. So it supplements my my fasting in the morning. When it comes to, we're going to talk a little bit this morning about brain health and about the different nutrition and vitamins that can contribute to brain health, guys. Melissa, good morning. Um, and Nancy is going to travel soon. Where are you going, Nancy, on a Wednesday? Um, but I want to chat a little bit with you guys on the importance of supplementing our brain function. And when I talk about supplementing our brain function with either vitamins or supplements, the first thing I want to tell you is that your food should be your medicine and not necessarily popping a bunch of pills. Uh, Good morning, Rosie. And I wonder if I can pull this up here so you can just have a speaker view with that. Let's see, pin video. There you go. And that, so that I'm not talking about popping vitamins and supplements, but you can certainly do that for your brain. But there are foods that we can eat that has the appropriate vitamins and supplements for brain function. The first thing you should know, though, is does anyone know what is the energy source for the brain? What is the fuel that fuels the brain? Do you guys know what fuels the brain? What is the gasoline that fuels your brain? Does anyone know? Type in the chat box if you do, or take a guess at it with that. Good morning, Tuik. What fuels our brain? It's probably not this orange thing. Good morning,
It's
Julie.
fat. Isn't it fat?
It's not fat. Fat
Not
doesn't
fat.
fuel our brain. Nope. Nope, fat doesn't fuel our brain. Is it?
Blood.
Blood? Blood brings the fuel to our brain. But what is in the blood that is the fuel for our brain? Right? Good morning, Cheryl. What is in the blood that fuels our brain? What is the energy source for the brain? And so the energy source for our brain, believe it or not, is actually sugar, right? The energy source for our brain is actually sugar. Now that kind of sounds counterintuitive. Yes, glucose, Cindy, glucose slash sugar, right? It sounds counterintuitive because when we think about sugar, we don't think of anything positive, right? It's uh, it's not. It's usually bad stuff when we think about sugar. But sugar or glucose is the energy source for our brain. Yes, to it. And what happens is this: in our brains, right? Blood is brought up in our brain, circulation. Super important that the sugar comes in through your circulation. Every heartbeat, every heartbeat pushes about a quarter of your blood. 25% of your total blood comes through your brain with each heartbeat. So, heartbeat, 25% of the blood goes up. Heartbeat, 25% of the blood goes up. So, circulation is super important, right, for optimal brain function. And we have connected poor circulation with dementia. In conditions like Alzheimer's, we know that if you take 10 patients with Alzheimer's, 8 out of the 10 have high blood pressure. Why? Because high blood pressure messes up your circulation, right? So 10 patients with Alzheimer's, 8 out of 10 has high blood pressure. 10 patients with Alzheimer's, 4 out of 10 have diabetes. So the question is, what does diabetes have to do with Alzheimer's? And it's because diabetes, the end result of diabetes, is simply poor circulation, right? The number one cause of death, right? Why do diabetics die? Does anyone know why diabetics die, guys? Diabetics die simply from heart attacks and strokes, which is basically a circulation problem, right? So the end result of diabetes is circulation. Again, circulation is very connected to Alzheimer's. If you are diabetic or pre-diabetic, your risk for Alzheimer's double, right? Compared to someone who's not a diabetic. Why is that important? That's important because it's something that is simply preventable and treatable. 2 out of 3 Americans currently are either diabetic or pre-diabetic. Okay, so diabetes though is a sugar problem, right? It's a problem with too much sugar. So here's something to think about. If your brain needs sugar for energy, if your brain needs sugar to function, but you have too much sugar from diabetes, why is that a bad thing? Why is too much sugar a bad thing if the brain needs sugar? Does anyone know? Is it kind of counterintuitive? Isn't, if the brain uses sugar or glucose for energy, why is having too much of it a bad thing for your brain? Does anyone know? Does anyone know? Good morning, Vivian. Why having too much sugar is a bad thing when it comes to diabetes. Type in the chat box. Take some guesses, guys, while I'm drinking my hopefully not sugary drink. I'm actually drinking Emergency. Emergency you can get at Target. Where else can you get Emergency? Costco. It's got vitamin C. It's got zinc. It's got vitamin D. Basically all stuff for your immune system. I like to drink a little bit of every day, or a lot of it actually, to keep my immune system up a little bit. with that. So Cindy says overexhaust. Good question. Good morning, Vicky. So in diabetics, when you have too much sugar, what happens is the brain develops, or your body develops, a condition that is called insulin resistance. Insulin resistance. What that means, what that means is that the insulin that is used by your body, right? The insulin that is used by your body to bring down your sugar level, right? What insulin does is that insulin is like the gatekeeper that stands in front of the brain cells, and it opens up the gate. It opens up the door to allow the sugar to go from your circulation into the brain cells so that the brain cells can use that sugar for energy. Okay? Am I making sense so far, guys? Insulin is the gatekeeper that stands in front of your brain cell, and it opens up the gate, it opens up the door for sugar to go from your circulation into your cell so that the cell can use it for energy. Okay? So Julie says too much sugar but not well circulate. Possibly, right? When there's too much sugar in your system, your body gets used to, right, all the insulin that's being produced and all the sugar that's around, so that insulin becomes resistant. It gets used to all the sugar that's going around the bloodstream. In diabetics, there's too much sugar. So what's happening is that when you become insulin resistant, your insulin stands there in front of the cell, but it's no longer opening the door. It's no longer letting in the sugar into the cell. So your brain cells are actually starving for sugar because insulin is not opening the door when it's so used to all the sugar that's floating around all the time. So lots of sugar from diabetics, but insulin is no longer working. It's not letting the sugar into the cell so that the cell in your brain can use it for energy. So, does that make sense so far? Let me know. Type in the chat box if it's making sense for you. I want to make sure that you guys understand it so that I haven't lost anyone. Okay, type in the chat box if that makes sense. Why diabetics have a lot of sugar, but the sugar is not being used by the cells. Right? Let me know if that makes sense. Good morning, Leslie. Okay, Rosie says yes. Yes, Cindy, diabetics are more tired often because their sugar is not being used. They got a lot of sugar in the blood, but the cells are not getting the sugar it needs because of either the lack of insulin, it dies over time, we burn out our pancreas, or insulin's not opening that door. Okay? Now, in patients with Alzheimer's, we find a consistent deficiency in the use of sugar in the brain cells. So the brain cells are starving for energy. When the brain cells are starving for energy, it does not function well. It leads to your brain cells dying, right? It leads to your brain cells dying. The brains are shrinking. And when your brain cells die, your brain starts to shrink. And when your brain starts to shrink, it's something we call dementia, right? With dementia, whether you have Parkinson's dementia dementia from having a stroke, dementia from Alzheimer's. The brain gets smaller and smaller and smaller over time. And it is the results of brain cells not functioning correctly. And it is due to brain cells being starved from sugar. So the answer, though, isn't to eat more sugar, right? That does not fix it. The answer isn't to eat more sugar. How do you fix a brain cell that's starving for sugar? What can we do to fix that? Yes, Julie, correct. A lot of sugar, but body doesn't break it into the cells. It doesn't allow it to the cells. So that's the problem with diabetics, right? So so how does the cell get energy if it cannot use sugar, like in a diabetic? How does a brain cell get energy if it cannot use sugar? Does anyone know? Does anyone know how a brain cell gets energy if it can't use sugar? I'm done with my emergency. I try to drink, guys. I try to drink one of these every morning. It is I think this is a 32 ouncer. Let's see, does it say 32 ounce? I think this is a 32 ouncer. This is equivalent to 4 cups of water, right? 8 glasses of water a day. And I do this in lieu of eating breakfast. I don't do breakfast. I normally wait till about lunchtime. And I don't do this, I don't eat breakfast for a reason. I don't eat breakfast for a reason. And this is where I'm going to teach you some stuff today. How many of you guys are familiar with intermittent fasting? How many of you guys are familiar? Vivian says it breaks down fat. Yes. When your body cannot use sugar, right, for energy, your body's plan B for energy is to start to break down fat for energy, right? How many of us could use some breaking down fat, right? How many of us can use some fat burning, right? Your body starts to burn fat for energy when it can't use sugar. Does anyone know what the byproduct is of burning fat? What is the byproduct of burning fat? Yes, Cindy, I am an intermittent faster. I get good results with it, and one of these lectures, I'll teach you all about intermittent fasting and the science behind that. What is the byproduct, guys, of burning fat? When you burn fat, what do you get from that fat burn? Does anyone know? Type in the chat box if you know. Well, yes, you get weight loss. Yes, you get weight loss. Awesome stuff. By the way, welcome to my office, guys. This is where I do consultations with patients. Oh, let me show you my office here. This is my little consultation office. Oh, and that is the 405 freeway. Can you guys see the 405 freeway? It's actually not too bad right now. So let me make a big old circle here. And I'm sitting in Irvine. So energy, huh? When you burn fat, you get energy. But what exactly is that byproduct of a fat burn that gives you energy? Okay. So what is that energy source that gives you energy when you burn fat? Does anyone know? So, yeah, traffic's light right now. It's probably due to pandemic coronavirus. Um, so it's not too bad. So the byproduct of fat burn is ketones. Ketones are produced from burning fat. Have you guys heard of the ketogenic diet? Right? I have just explained to you the ketogenic diet, which is which can be achieved simply through intermittent fasting. Right? Let me type down ketones here for you. Right? So the ketogenic diet, really the goal of the ketogenic diet is simply to produce ketones, right? I'm and I believe that you can get to fat burn not necessarily by eating a bunch of meat, eating a bunch of fat. Um, Obviously, you get to fat burn if you have sugar that's being inefficiently used, right? Your body is starving from sugar. One way to get your sugar level to be low so that your body can start to burn fat is simply intermittent fasting, right? When you wake up in the morning and you don't have breakfast and you drink like a drink, like water, and your sugar is low, right? When you wake up in the morning and you don't have breakfast and you drink water instead, and your sugar level is low because there's no breakfast, your body resorts to burning ketones, right? Hey, Pat, good morning, right? Yeah, I don't know when I'm on either. I just come on whenever. But actually, I think today's Wednesday, right? So I'm planning to come on every other Wednesday with this is a, memorial care event with memorial care with you guys, and then every Thursday morning, of course, I do the health talks with Dr. Trin on Thursday morning. That's with OC Health Talk. It's like a radio show. Every Thursday morning, it's on radio, but we do it with Facebook Live for you guys as well. Um, and then I'm alternating. I think every Wednesday to every Thursday. I mean, no, every Wednesday and every Tuesday, I'm gonna alternate these morning talks. But every Thursday is pretty consistent. Every Thursday is consistent at 8 a.m. With that. Okay, I'm confusing myself, guys. So anyway, back to getting to ketones. Back to getting to ketones. If your body doesn't have sugar and the sugar is not used well because insulin's not opening the door due to insulin resistance, your body burns fat next. Okay, that is plan B. If sugar is not being used, it burns fat. When it burns fat, that fat that's being burned will cause weight loss. For those of you who need, for those of you who need to some weight loss, I've just shown you how to do it. You simply allow your body to burn fat by having no sugar. And you can get there by intermittent fasting, right? And so there's no breakfast, the sugar is low, the body burns fat. Patricia, you're hypoglycemic. Talk to me. There are some strategies to get around that. And and so your body burns fat, the fat becomes ketones. The ketones is now used for energy. It is now used for energy in lieu of sugar. So if your body is a car, right? If your body is a car, and good morning, Kim. If your body is a car and that car needs energy, it can use either sugar or that car needs gas, right? That gas can either be sugar or it can be ketones. The difference is that sugar is like regular unleaded gas, whereas ketones is supreme or super unleaded gas. The body uses ketones more efficiently than it uses sugar. Does that make sense? The body uses ketones more efficiently than it uses sugar. Good morning, Mona. Right? And so, one way of getting around memory deficiencies, memory deficiencies from problems like dementia or problems from having a sugar fog, um, it's really simple. Is you replace that energy, the sugar energy, with ketones. And ketones can sometimes be used now for the brain cells as opposed to sugar. And it does help. There are some studies, some preliminary studies, showing some benefit in cognitive loss or early memory loss by supplementing sugar with ketones. Okay, so that's one nutritional supplement. And guys, you don't necessarily have to go out and buy ketones or eat ketones. You can do that by cutting down the sugar in your diet so that your body resorts to burning fat. And that fat burn will lead to ketone production. Am I making sense so far for you guys? Type in yes if you're following me so far. I want to make sure that I haven't lost anyone in chatting with you guys here. Okay, ketones in lieu of sugar for energy use. With that, all right, Margie, cool. Ketones in lieu of sugar for energy source for the brain. For the brain. Do you guys want to see some published clinical studies that shows that? Okay, I will show you some published clinical studies where ketones is used for energy to help with brain function. Now, there are many ways to get ketones. The studies that have been published for ketones, they gave patients with Alzheimer's, they gave patients with memory loss ketone supplements. Okay, and those ketone supplements are called MCT oil, which is medium chain triglyceride. I'll type it down for you guys here. MCT oil. So MCT oil was used in the clinical studies to provide a source of ketones for patients with memory loss. And again, these are patients in the early phases of memory loss with Alzheimer's or cognitive decline. So they gave these patients MCT oil, which is ketones, to fuel their brain. Because again, a brain with Alzheimer's is not using sugar efficiently. Okay? So are you guys ready to see some studies? I'm going to share my screen now, okay? And we'll go to the studies. Let me see. Let me share my screen. So I'm going to share, let me see. You're on Facebook Live. How do I share my screen? Because I got to go to the studies in Facebook. Whiteboard. Let me see. Shoot. Okay. I may not be able to share my screen because the studies are on Facebook. If I share my screen, I'm going to lose the Facebook Live. But I'll tell you where to go get the studies. Go to the Longevity Institute, which is a page that we are in, that we run on Facebook. The Longevity Institute page. Ask permission to join it. I'll give you permission to join it. And then go to units. Go to the units in the Longevity Institute. And in those units, click Alzheimer's and ketosis. click on Alzheimer's and ketosis, you're going to see a whole bunch of published research on how the use of MCT oil or ketones have improved cognitive decline, right? That have improved memory loss. If you guys are all on Zoom, I can go to Facebook and show you, but since we're doing a Facebook Live, we can't really show you uh, and be able to. Hold on, maybe I could. Let me take. If I share screen, no, I can't. I can't because then I have to leave Facebook Live with that. So one strategy, guys, of improving cognitive function is simply intermittent fasting. I am mostly. How many of you guys have tried intermittent fasting before? Type yes if you tried intermittent fasting or if you're doing it now. And tell me if you notice that your brain functions a little bit better when you're fasting versus when you're eating, 3 times a day plus snacks and all that. For me, Jose says yes. Jose, why don't you come on Zoom and share with us your experience with intermittent fasting since you're on Zoom here.
Yeah. So my wife and I we tried it. I couldn't hang. I would get angry. So and then especially with coffee and creamer and stuff like that.
I don't see you.
My wife. Oh, here, let me put my camera on. There you go. Yeah, so we both tried it. I gave up after a week or so. Just no creamer with my coffee and cookies or peanut butter and jelly sandwiches in the morning. That was tough. And my wife, she stays at home, so she's got more of the flexibility to prepare her meals or whatever. But or be a little stronger. But I'm on the road all the time, so
you gotta eat.
So I see a drive-thru. I was like, oh man, that sounds good.
It's like I'm intermittent fasting, but I'm driving by like In-N-Out Burger.
Yeah, In-N-Out, and then the smell. I mean, that thing is like, yeah, it just drives you to the drive-thru.
Oh my gosh. So. Okay. Yes, not easy to do. Anyone else want to share their intermittent fasting experience? I can send you my Zoom link. You can go on Zoom and share if you want to. Just say yes, you want to share. Or Patricia, Leslie, you've done intermittent fasting. Or you can type in your experience of how intermittent fasting does for you. Is it good? Is it bad? Does it do anything to your brain? Does it help? Is it more clear for you? Type in the chat box, or you can totally come on Zoom with us and share as well. But I can tell you that when in the morning, when I'm fasting and I haven't had lunch or breakfast, I'm probably most clear in the morning up here. How many of us get brain fog after lunch? Right? Vivian's trying it now. Type in your experience, Vivian. How's it doing for you? Right? How many of us get brain fog after lunch? Brain fog is from that spike in sugar and the crash in sugar, right? Sugar fogs our brains. When we don't have sugar and we're fueling our brain with ketone energy, right? The brain fog goes away because the brain uses ketones at a 40% more efficient rate than it uses sugar for energy. So let me say that again. The brain uses ketones at a 40% more efficient rate than it uses sugar for energy. So the brain can either use sugar or it can use ketones for energy. All your body cells, same thing. It can use sugar or it can use ketones for energy, but it uses ketones more efficiently than it uses sugar with that. Vivian says she does notice her memory is better when you're intermittent fasting. What do you notice, Cindy? What do you notice when you're doing that? Um, Rosie says she gets brain fog. So, yeah, Rosie, I get rid of brain fog through intermittent fasting, but I do realize that there are folks who may have low blood sugar if they fast too low, and there are patients who have diabetes who are on insulin or diabetic medications that maybe should not be fasting, right? Because you don't want your sugar to crash as a result of being on insulin and fasting at the same time. There are strategies to get around that, guys. I give those strategies individually to patients when I'm doing a one-on-one conversation with them. Leslie says, I found that once I get over the initial hangry for a couple of weeks, your body works well with intermittent fasting. You don't miss eating until lunch. Um, yeah, you don't really feel weak, Leslie. And the reason you don't feel weak when you're intermittent fasting is because you're simply switching energy source from sugar energy over to ketone energy. So it's not the lack of energy when you're fasting, it's changing energy source. It's a switch, right? You were burning sugar, but now you're burning fat. And that fat becomes ketones. And that ketone is now used for energy, which is why you don't feel weak. It's just a different energy source with that. Okay? Cindy says, oh, brain fog. Yes. Can't do intermittent fasting. Not ready for it. I can do an intermittent fasting chat for you guys, maybe next week or something. Patricia says, you go pale and thought you would faint. Dr. Hung's office for my husband. And he gave you some cookies, Patricia. Wow. Or sucking on a piece of candy. Yes, because when you're fasting, what happens is, and intermittent fasting is the hardest. Intermittent fasting is the hardest. The first week is tried. But normally on week 2, week 3, week 4, it gets much easier. The first week that people try intermittent fasting, they get very hungry. They feel weak. Why is that? It's because your body is like, where is the sugar from my breakfast, right? Where's the sugar from my breakfast? And your body doesn't know how to burn fat yet. The body isn't experienced with burning fat because it never had to burn fat, right? Most of our bodies never had to burn fat because we eat 3 meals a day along with snacks. So we always have sugar on board, right? We always have sugar on board. We've never needed to burn fat. So it doesn't know how to burn fat. It's like, good morning, Michelle. And so it's like trying to start a car that hasn't ran for like a year, right? So your car hasn't started for a year and you're trying to start it. So you're just, and if it hasn't been running for a year, you're just cranking it, right? Crank, 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 because it hasn't ran. So that's week number 1. Week number 1 is your body is trying to learn how to burn fat when there's no sugar on board. So it's cranking. And as it's cranking, it makes you super cranky, right? You get cranky as a result of that. And so you get hungry, you get angry, you get hangry, right? Angry, hangry, hungry. And that's week number 1. Week number 2, your body has learned how to start that car. And so week number 2, your body has learned how to burn fat. And once it has learned how to burn fat to make ketones for energy, the feeling of weakness and the feeling of tiredness from not eating breakfast, it goes away. because now you're using ketones effectively for energy. Okay? Does that make sense so far, guys? Does that make sense for you guys? I want to make sure that I'm making sense for you and that I haven't lost anyone. Yeah, maybe next week, some of this time we'll talk about intermittent fasting for you guys and give you a deep dive, right, on intermittent fasting and the health benefits behind that for you. But certainly today I wanted to tell you about brain function, nutritional supplements, and the nutritional supplement is really what I'm talking about. What I'm focused on today is really ketones. The use of ketones for your brain when your brain is not having sugar on board, or when your brain's not using sugar well because of dementia, because of Alzheimer's and things of that sort, right? And so if you switch brain source over to ketones, the brain can use ketones for energy. So so that's kind of the point that I wanted to get across today for you guys with that. Oh, hey, I want to let you know that if you wanted COVID testing through a nose swab, today is day one that we are offering it at the Anaheim Convention Center for coronavirus testing. If you're symptomatic or if you've been exposed to folks who have coronavirus and you want to be sure and you want to check through a nasal swab, we're offering that at no cost. It is completely free. Especially if you have insurance, we'll build insurance with that. At the Anaheim Convention Center, guys, open today. You need to make an appointment. Look on my Facebook page and you'll see how to make an appointment. I think I posted that last night. In a few weeks, sometime in August, we're also going to open up coronavirus testing at the Orange County Fairground. It's going to be a drive-through for both of these locations. So you don't get out of the car, you stay in your car, bring a mask with you, and we'll swab your, or you'll swab your nose for coronavirus. It takes us a few days to get results back. And again, it's no cost to you. So let your family and friends know that coronavirus testing is now available in Orange County in mass locations. Today, again, is Anaheim Convention Center. All right, guys, it's almost 10 o'clock. So I'm going to close it here. Good chatting with you guys. Jose, do you want to come back on and say a little bit about Memorial Care or anything you want to chat about before we end it here?
Yeah, thank you so much. Like Dr. Trent said, I work for Memorial Care Medical Group, and very excited. Thank you so much, Dr. Trent, for helping me out with these lectures and everything you do in the community, not only here in the States, but abroad. So it's amazing all the work you do day in, day out. So just a little bit of information about Memorial Care. We are one of the largest medical groups here in Orange County. We have offices from San Clemente all over to Torrance, Long Beach. So if you have any questions, please feel free to give me a call or email me. My cell phone number, I think we can add it on the Facebook chat. So if you have any questions, anybody that's turning 65, everybody looks young in the group. But yeah, several unique things about our group is that, we try to keep everything in-house with our x-rays, labs. Once you're part of our network, you can see any primary care physician. So that's a great, good freedom to have. Obviously, top leading hospitals, Saddleback Hospital, Orange Coast Memorial, Fountain Valley, and Long Beach Memorial. So, yeah.
What's your phone number? What's your phone number? I'll type it out.
Okay. It's 714. 640.
Okay.
7158.
71. So folks can contact you for what? For like parties? Or
even better. No, so anybody that has questions or you need information about our network, our urgent care locations, provider directories, you have questions about a family member that is joining Medicare. Mm-hmm. We are hosting a lot of Zoom meetings based on Medicare, and especially now that the Social Security offices are closed. Mm-hmm. So there's a lot of confusion with that. So, I can help you navigate how to apply for Medicare or any questions you may have. I know a lot of people are getting laid off right now too, so they're not sure if they can, what's going to happen to their insurance, and if they can apply for Medicare after their 65th birthday, or what's the time frame to apply for Medicare. So there's a lot of information out there. So don't feel lost or confused. Just feel free to give me a call.
Do you have to apply for Medicare, or is it automatically given to you when you turn 65?
It varies. So because it's funny, sometimes like if you're still working, somehow, I don't know, Social Security doesn't mail out your Medicare card.
Interesting.
Sometimes you do, but just know that whenever they do, they'll start deducting your 144 monthly premium out of your Social Security. So a lot of people are not even aware. They just don't do anything about it. So you're wasting money there. Another very important time frame is when you lose your employer's coverage, you have 63 days to apply for Medicare. If not, you have to wait for a whole year, and then you'll get penalized for the 1 year.
Wow.
Yeah. Another thing is that you're going to need a form from your employer stating that after your 65th birthday, you were still insured under your employer's insurance. And that's a form that, you're going to need that. So you can download it from either Medicare.gov, or you can go onto our website. We have that form on our website as well at memorialcare.org. Okay. Or you can just text me, and I'll be more than happy to text back to you or email it to you. So there's a lot of little things out there that, a lot of people are not aware. So
totally,
just keep those dates in mind. Yeah.
Okay. All right. Good information. Thanks so much, Jose.
Yeah, definitely. Thank you, Dr. Trinh.
All right. So we'll chat again next week.
All right. Sounds good. I'll see you on Tuesday.
I'll see you Tuesday. Next Tuesday, guys. What time? 9?
9.
Okay, next Tuesday, Memorial Care Lecture, Facebook Live, 9 a.m. And we'll chat. And then again, every Thursday, which is, I guess, tomorrow at 8, I'll be on here as well. So, nice. All right, we're all set then.
All right, thank you so much, Dr. Trent. Have a great day.
Okay, you too. See ya.
Thank you.
Bye. See you guys later on Facebook. Exit full screen. Exit this, and meeting for all. Turn this on. And then end Facebook Live.